Hello, everyone. Welcome back. If you were just listening to me on part one of the Daily Health Report, thanks for joining me for part two. This is Dr. Alenov's Daily Health Report. This is number 6, and this here is the live daily stress release portion of my report. And in report number 5, we went through a rather in-depth look into what we can do for ourselves as far as stress release using some of the best methods known: breathing, deep breath exercises, as well as eye movement. And so in some of my earlier reports, I had demonstrated the eye movement, but this week and next, what we're going to do is we're really going to focus on the breath. And so I'm not going to chat about it like I did yesterday. What we're going to do next is we're going to actually demonstrate this breath. Pardon me while I make sure my live broadcast is on. Doing well. All right. Thank you. And so what I want to do today is, if you watched part 5, that was mostly talk. Right now, we are actually going to practice the breath work as described. And again, this is Wim Hof style breathing, which is by and large the best direct method of affecting and changing your stress levels on a neurologic level, which will, when your nervous system changes, it changes everything in your body. It can change your physiology, it can change your oxygenation levels, it can change how you feel and how you relax, how you digest. I mean, it just changes so many things. Here I go, I'm talking again. All right. So I know I have to watch out for that. Happens quite easily. So here we go. I'm going to just describe, for you who are new to this, what the breathing cycle is like, and then we're going to jump right into it. And we're going to do a full stress release breath workshop, right? And this is what you should be doing at minimum once a day, especially for all you patients out there who are listening, my patients. And I've recommended that you come here, and that's all of you mostly, at minimum once a day, right? If we're not doing this once a day, then we have not committed. We're not serious to really making a difference in how we manage and release our stresses. Our stresses are not going to just evaporate because we want them to go away, or because we're willing them away, or because we're wishing them away. It's not going to work. We have to do an actual practice of neurologically, physiologically shifting the body. And the breath work is the most incredible way of doing that. Okay, so we're going to do a full cycle. And what that means is 3 repetitions of this cycle. And what one cycle is 30 breaths in and out, as deep and as full as you can do. And then after the 30 breaths, you're going to breathe all the way out, release all the air from your lungs, and you're going to stop. And when you stop, what's going to happen is you are just going to be silent. You're basically holding your breath, but you're not holding the breath in. You breathe out first, and then you stop. So you're holding your breath at the bottom. Now, you do not have to struggle at this, right? I'm not going to go my full distance. We're just going to do that for about 30 to 60 seconds. Most people can do a minute easily. Then, once you're ready to take that first breath again, you breathe in, because you already breathed out. So all you do is breathe back in, hold it for about 10 seconds, and then relax. And now you're going to regular breathing. All right. That is one cycle. And we're going to do 3 of those. All right. And so this is the whole thing. This is the whole system that you need to be doing regularly, once a day, preferably twice a day, in the morning to start the day, and then at the end of the day to end it. And so if you don't have time to do this right now, go ahead and hit pause, close this down, open it up again this evening or right before bed when you're ready to relax and let that stress release from your body and from your mind. Okay, so here we go. Remember, the breath is mostly open mouth because we're letting everything in. You can do through the nose if you'd like, but that usually slows things down. So I'm going to do a full mouth open. I'm not going to stop air from coming in my nose. So it actually, I open both my mouth and my sinuses up when I breathe in like this. Everything's open. It's very quiet. I'm not breathing in through a straw. I'm not breathing in quickly through my sinuses, which is kind of a struggle. Everything's open. My shoulders are relaxed, and I breathe in and then out. And it doesn't have to be super rushed, but you don't want it to be slow either. So we're going to do a medium pace, follow along, and here we go. Starting that whole cycle now, and breathe in. That's 10. Keep breathing. Twenty. Keep going. Two more. Last one. Breathe out. All the way, all the way. Stop. If you can, keep holding. I'm just going to walk you through that. If you're done, just take that breath in. Hold it in. And then out. All right, that's one cycle. If you're still holding, you haven't had any urge to breathe, go ahead and keep holding. It is this extreme oxygenation, opening up the life force with the breath, followed by the breath hold that allows us to change our neurology. Okay, if you're letting go right now, let go, breathe in. Okay, and now you can relax. You don't have to jump right into the second of the three cycles. You can give yourself a minute to relax, listen for a second. Okay, just kind of relax, roll the shoulders back. One thing I'll mention, which you might already have noticed, is that when you're taking full breaths, very full, we want to breathe in as much as possible lower. We want to breathe down past our chest into our abdomen, right? So we want to open up the belly. We want to breathe in like this and breathe in and really suck that air in through the abdomen. That's very important. However, when you're really, as you get used to this, now if it's tight and you just can't get a full breath, that's okay. You don't want to force it. You don't want to feel like you're hurting yourself. But as it gets deeper and deeper, you'll notice that the chest moves less and less as we get deeper into our abdomen. Okay. But at first, while we're taking deep breaths, if we're over forcing it, what's going to happen is 20% of your oxygen can come in through the upper part of the shoulders. Your ribs can be pulled up with your neck, trap, and the shoulder muscles. So if you're doing that 30, 60, 90 times, when you're done, you might notice you have some major tension on the side of your neck. And if you're noticing that, it's specifically because your muscles here are tightening up to try to lift that rib cage. So if this is uncomfortable, if it's causing tension, you're noticing that tension, and even it can come up into the back of the occipital area and cause headaches, then simply the next round, breathe more gently. It does not have to be a deep, full breath. I'm experienced in breathing. I've done it for many, many years. So I'm showing you a full breath. I'm actually quite tight today, so my breath is not as full as normal because I've been doing other videos, and my diaphragm tightens up with all the talking. So just a note, if you're getting that tension, then just do not take as deep of a breath. Okay, we're ready for the second cycle. You'll see here, I usually count with my fingers because I lose count in my head. So I go 10, 20, 30 over here, and then I go up and down. So that's 10, up and down. That's 20, up and down 30. It's just the habit I've gotten into. You can do it however you would like. And I'm going to start a timer on our breath hold, so you can follow along with that. And here we go. 30 breaths, relaxed, open mouth, and begin. It's 10. 20. 'Last breath in. Hold that in. Keep holding. and out. Okay, that was round 2. Very good. So we held for a minute. If you're still holding, that's totally fine. Keep holding. Take your time. One thing about the holding, again, you don't want to fight it or hold it in. You want it to be a peaceful, relaxing experience. You're going to really learn to like these breath holds. You're going to learn to love them, because especially when you're doing it in a quiet place, hopefully you can find that to do this. Um, it's like a moment of perfect peace where everything in your mind and your body just stops. And at those moments, we usually get feelings. We either observe the piece and we enjoy that, or we're going to observe our feelings. Our emotions are going to come up. Do not be surprised if you're out there and you're going through 1 or 2 or 3 of these cycles and suddenly you begin to cry. Okay. For beginners, that happens all the time. And it's because the breath work is very powerful, and it really does allow us to drop our shields and drop our restrictions. And especially we stop trying to ignore our feelings, and we're actually connecting with them. So this is very, very important part of that. Okay, like I said, I'm going to cut down on the talking. This is about the breath work. And so here we go for cycle 3. Hang in there with me. If you're feeling dizzy at all, that is normal. Hopefully you're doing this sitting on the floor or kneeling. I'm sitting, of course, in a chair, on the edge of the chair. I like to lean my pelvis forward to open up and kind of push my belly outward. And what that does, it allows more room for my organs to relax and for the diaphragm to pull the lungs down. Your diaphragm muscle is right here, and it needs to pull down, and that is how the air comes in. And when you're forcing it, you can hear that breath coming in, that deep breath. You can hear it when I'm breathing in. That's because I'm not just passively breathing, which uses maybe 20 to 30% of my lung capacity, right? We are forcing it down as deep as we can, or as comfortably as we can take a deep breath. So you're increasing to 40, 50, 60% capacity. It's going to take a long time to get to that point where you feel full 100% capacity. This is one of the essential 5. Movement. We talk about movement in the essential 5, but not just typical exercise, running around, moving our body. That's, of course, important, but movement of breath and learning how to reconnect our mind to our breath, which is what breath work does. Always have water around between cycles, especially if you live in a dry place, a desert, or in the chilly, cold upper Midwest where we are right here, because it can get dry in the mouth. All right, next and last cycle today. Here we go. And beginning our breaths. And 1. Ten more. 2, 1. Last breath in. Deep breath out. All the air out and stop. Okay. And that was three full breath cycles. Very, very good. By the way, again, you want that breath out and that hold to be a pleasant experience. If it's only 10 seconds, that's fine. 30 seconds, a minute, minute and a half. Eventually it will grow. It'll go up, up, up. You'll notice it's not just because I'm on camera. I always make sure I'm smiling during my breath hold. Okay. Because again, a smile says to me, it says to my nervous system, when you smile, you're telling your brain everything's okay, everything's good out here. And so if you're concerned and you're frowning or holding it in, if you have a bitter look on your face, that's telling your brain, I don't like this. This is bad for me. So again, another little side note is a smile during the breath hold helps very, very well. Hopefully my smile turned into your smile. Let me go ahead and stop that. And thank you again for joining me. So that is report number 6. Again, if you haven't watched report number 5, my section on breath work, I would go ahead and revisit that so you can kind of understand the history behind that, why I've chosen this style of breathing. And otherwise, I look forward to seeing you all again very, very soon. Have a wonderful rest of your day.